picture this. You know your body is changing. Like maybe you're suddenly staring at the ceiling at 3 a.m.,
Oh, yeah.
completely unable to sleep. Or, you're dealing with this thick, heavy brain fog that makes it so hard to just focus in meetings.
Right. It's
And
overwhelming.
your periods, which used to arrive like absolute clockwork, are suddenly wildly unpredictable.
Mhm.
So you do the responsible thing. You go to the doctor.
As you should.
Right, you list all these incredibly disruptive symptoms, they run a hormone blood test, and a few days later, the results come back perfectly, frustratingly normal.
Frustrating is putting it mildly.
Exactly.
Right.
And you are left sitting there wondering, like, am I imagining this? Am I losing my mind? Why doesn't the test match how I actually feel?
It is honestly an incredibly invalidating experience. And the heartbreaking thing is that it happens in clinics around the world, like every single day.
Yeah, which is just wild to me.
It is. The reality of perimenopause is that it's a gradual, chaotic, hormonal transition. It's an entire era of your life. It is absolutely not a sudden switch that just gets flipped overnight.
Right, it's not just on or off.
Exactly. But standard medical testing, particularly, the single draw blood test, it just fundamentally struggles to capture that reality.
Which is exactly why we are doing this deep dive today. We want to uncover why that normal blood test is, well, frankly, completely lying to you.
Yeah, it really is.
And we're going to look at why chasing those hormone levels can actually delay you from getting the relief you actually need. We have a massive stack of sources today.
We really do. Some incredible data in here.
Yeah, we're pulling from clinical guidelines from the British Menopause Society, plus some fascinating research from the Center for Menstrual Cycle and Ovulation Research, and this massive set of continuous hormone tracking data from UVA.
Which is a game changer, honestly.
Truly. So let's start with the sheer biology of what is happening in the body, because the numbers here are just staggering. We are born with about 2 million eggs,
Million.
but by the time a woman reaches age 40, only about 3% of that egg supply remains.
And that 3% mark, that's a critical biological threshold. To understand why your body starts behaving so unpredictably, we have to look at the conversation happening between your brain and your ovaries.
Okay, lay it on us.
So normally, this is a beautiful, continuous feedback loop. The brain produces a messenger called follicle-stimulating hormone, or FSH.
Right, FSH.
Think of FSH as the brain's way of talking to the ovaries, basically telling them to develop a follicle and release an egg.
Okay.
When an egg is successfully released, the ovaries produce estrogen and progesterone. Those hormones travel back up to the brain, essentially signaling, hey, the job is done.
Mission accomplished.
Exactly. And then the brain lowers the FSH levels.
It's a nice, neat, predictable loop. Like the brain asks for an egg, the ovaries deliver, the hormones confirm it, and everything resets.
Precisely how it works in your 20s and early 30s. But as that egg supply drops to 3% and below, the remaining follicles become much less responsive.
Because they're aging.
Right. They are aging. The ovaries start dragging their feet. So what does the brain do when the ovaries aren't listening?
It gets louder.
It starts shouting. It pumps out more and more FSH to force the ovaries to work harder. And because the whole system is straining, the actual production of estrogen and progesterone becomes incredibly erratic.
Okay, let's unpack this. Because if I'm running out of eggs and my ovaries are slowing down, shouldn't my hormones just sort of, I don't know, drain out like a leaky tire?
Like a slow fade.
Yeah, just a slow, steady fade to zero.
That is the logical assumption. And honestly, it's what most of us were taught in high school biology.
Right.
But the reality is far more turbulent. Taking a single blood test during this phase to check your FSH or your estrogen is essentially like taking a single photograph of a roller coaster.
Ooh, I like that analogy.
Yeah, so a snapshot might show the roller coaster cart sitting perfectly level, looking totally calm.
Right, it looks fine.
But what that photograph completely misses is the 100-foot vertical drop that happened literally 2 seconds prior.
Oh, wow. Or the massive loop-de-loop coming right around the corner.
Exactly.
So a single blood draw is literally just telling me what my hormones are doing at like 9 a.m. on a Tuesday.
Just that specific Tuesday. Because your brain is shouting with FSH and your ovaries are sputtering, your hormones are fluctuating wildly day by day.
Or even hour by hour, right?
Yes. You could have your blood drawn on that Tuesday, and the lab results will say you are perfectly normal.
Meaning in a premenopausal range.
Right. But you could go back to the exact same clinic on Thursday, and that same test might show levels that look completely postmenopausal.
Just 2 days later.
Just 2 days.
That is wild. So if a snapshot completely misses the movie, why is it so chaotic? Like, why doesn't it just slowly decline?
This brings us to a phenomenon known as loopy events. That stands for luteal out-of-phase cycles.
LP events.
Okay, remember how we said the brain is pumping out high levels of FSH, effectively shouting at the tired ovaries?
Yeah, trying to force them to release an egg.
Because there's so much of that shouting hormone circulating early in your cycle, it can accidentally trigger a second follicle to start growing entirely too early.
Wait, a second one?
Yeah, sometimes this happens before your previous menstrual cycle has even finished.
Here's where it gets really interesting. If perimenopause is supposed to be the phase of life where you are running out of estrogen,
Right.
how does a second premature follicle change things? Like, doesn't that add more?
It does. It causes a biological pileup called estrogen stacking.
Estrogen stacking, wow.
The old follicle from your previous cycle is still lingering and producing some estrogen, and now this new premature follicle starts pumping out its own estrogen right on top of it.
Oh my gosh, so it's double.
Exactly.
Yeah.
Because of this stacking effect, women in perimenopause can actually experience estrogen levels that are much, much higher than they ever were in their peak reproductive years.
That is just wild. You go into perimenopause expecting your estrogen to disappear, but you're actually getting hit with double doses.
It is a profound paradox, and it entirely explains those incredibly erratic physical symptoms.
It's like what?
Well, when your estrogen spikes to those unprecedented levels, it causes the uterine lining to build up excessively.
Which leads to the extremely heavy menstrual bleeding.
Right. It also causes severe, painful breast tenderness and intense, volatile mood swings.
Oh,
And then, because that spike is artificial and unsustainable, the stacked estrogen violently crashes.
let me guess. That steep drop is what triggers the sudden hot flashes and drenching night sweats.
You got it. The drop is the trigger.
Which perfectly illustrates why a blood test looking for low estrogen will be completely fooled.
Exactly.
Like, the test might catch you on Tuesday during an estrogen spike, and your doctor will look at the paper and say, well, your estrogen is actually quite high. You definitely aren't in perimenopause.
Well, when biologically speaking, that extreme chaotic spike is the very proof that you are in the thick of the transition.
Right. The chaos is the defining feature, not the decline.
Absolutely.
And this has massive real-world fallout for anyone sitting in a doctor's office. Because these misleading tests, they aren't just an academic debate. They have deeply emotional consequences.
So much unnecessary suffering.
Yeah. If a snapshot test comes back normal, doctors will frequently dismiss the patient's very real physical suffering.
Right. You might be told it's not perimenopause, it's just stress.
Or it's just anxiety, here's a prescription for an antidepressant.
Which happens all the time.
Yeah.
But the flip side of that misdiagnosis is just as damaging.
What do you mean?
Well, sometimes that snapshot catches a spike in FSH and a temporary dip in estrogen, and the lab flags it as postmenopausal.
Oh, no.
Yeah, there are women sitting in clinics still having regular menstrual cycles who are suddenly told by their provider that they are definitively postmenopausal and their childbearing years are over.
That is awful.
Yeah.
It causes immense, completely unnecessary psychological shock.
Completely. Medically, you cannot be postmenopausal if you are still menstruating.
Right.
But the snapshot test fools the provider into giving a devastating misdiagnosis.
It's infuriating because it completely ignores what you're actually feeling in your own body.
Yeah.
Which is where the continuous data changes everything, right?
Oh, absolutely.
We looked at the hormone tracking company UVA. They tracked over 10,000 women using daily urine tests.
Finally watching the movie instead of just taking the photograph.
Exactly. And they found that 73% of women feel, quote, something is different in their bodies 6 to 18 months before any changes to their period even occur.
What's fascinating here is that the beauty of that daily tracking data is that it finally gives the medical community the language to explain why women feel so different so early on.
Right.
Because standard blood tests have failed us for so long, we largely miss that perimenopause is not a one-size-fits-all experience. The UVA data revealed 4 distinct hormonal patterns.
Let's break those down, because I guarantee you're going to recognize your own experience in at least one of these.
Oh, for sure.
Pattern 1 is what we just talked about, the erratic estrogen pattern.
The hallmark here is the roller coaster. Wild, unpredictable estrogen stacking, followed by sudden drops. These are the women experiencing the heavy bleeding, the swollen breasts.
And then the sudden hot flashes when the floor just drops out from under their estrogen levels.
Exactly.
But the data showed that's not the only way it happens.
Yeah.
Pattern 2 completely flips the script. It's the progesterone first pattern.
Yes.
And I want to pause here because we hear so much about estrogen. Why is progesterone taking the lead in this pattern?
To understand this, we have to look at what happens when you don't release an egg.
Okay.
As your ovaries age, you start having anovulatory cycles. Those are cycles where no egg is actually released.
No egg drops, right?
Progesterone is primarily produced by the empty follicle after an egg drops. So no egg means virtually no progesterone is made that month.
Wow.
In this second pattern, a woman's estrogen levels might stay relatively stable, but her progesterone production falls off a cliff.
So what does that actually do to the body?
Progesterone is the hormone that balances estrogen, but crucially, it also has a profound calming effect on the brain.
Oh, really?
Yes, it binds to GABA receptors, which are the exact same receptors that anti-anxiety medications target.
Wait, so it's like a natural anti-anxiety compound?
Exactly. When your progesterone drops first, you lose your body's natural calming agent.
Oh my gosh.
You end up in a state of relative estrogen dominance. These women don't get hot flashes right away. Instead, they get crushing anxiety.
Severe PMS.
Severe PMS, heart palpitations, and terrible sleep disruption.
So you go to the doctor complaining of rolling panic attacks and insomnia.
Yep.
The doctor runs the standard snapshot blood test, checks your estrogen, sees it's, quote, normal, and completely misses the perimenopause diagnosis because they aren't factoring in the catastrophic drop in progesterone.
It's a massive clinical blind spot, and it's why so many women are offered sleep aids or anxiety medication instead of actual hormonal support.
That is just, wow. Okay, moving to pattern 3, the quiet decline.
Right?
I feel like this is what society thinks perimenopause is supposed to be.
This is the textbook version, though ironically it's not the most common.
Really?
Yeah. In the quiet decline, both estrogen and progesterone slowly and relatively smoothly fade out together.
No roller coaster.
Right. The roller coaster doesn't have those massive drops. Cycles just gradually get longer and further apart.
So what are the symptoms like?
They're less volatile, but much more consistent. Steady, grinding fatigue, vaginal dryness, aching joints, and overall hair thinning.
Okay. And finally, pattern 4, the cortisol-driven pattern.
This one is fascinating.
We all know cortisol is the stress hormone. But how does a stressful job or like a life situation actually change what my reproductive hormones are doing?
This is where biology gets truly incredible. Your body uses a master raw material, a precursor hormone called pregnenolone, to make your other hormones.
Pregnenolone, okay.
It can use pregnenolone to make progesterone, or it can use it to make cortisol.
Oh, so it has to choose.
Exactly. When you are under chronic stress, which midlife often brings with, career peaks, aging parents, and teenagers.
Basically everyone's life right now.
Right. Your body enters survival mode. It performs what we call the pregnenolone steal.
The pregnenolone steal.
It steals that raw material away from making calming progesterone and diverts it entirely to making stress-fighting cortisol.
Wow, so your body is literally prioritizing survival over reproduction.
Exactly. So high stress actively starves your body of progesterone.
Which amplifies the hormonal chaos.
And it makes every other perimenopause symptom significantly worse. It also drives insulin resistance, which leads to that incredibly stubborn abdominal weight gain so many women experience.
So we have all this biological chaos, these complex patterns of pregnenolone steals and estrogen stacking, and a snapshot blood test that clearly can't capture any of it reliably.
Not even close.
Which begs the question, if these blood tests are this useless for diagnosis, why on earth do I see advertisements for clinics everywhere offering to test and, quote, balance my hormones?
Well, there is a lot of validity to the frustration surrounding those clinics. Some boutique out-of-pocket clinics will order massive, highly expensive panels of hormone blood tests, and then they use those snapshot results to sell you their own proprietary supplements to supposedly balance your hormones.
Of course.
But as we've established, balanced hormones on a Tuesday morning blood test do not equate to balanced hormones on a Thursday afternoon.
Right.
Chasing those numbers is a fool's errand.
So what do the actual major medical guidelines say about this? Because we pulled from the best of the best.
They did, and the clinical stance from the top medical bodies is incredibly unified.
Okay, what do they say?
The National Institute for Health and Care Excellence, NICE, and the British Menopause Society are crystal clear. For women over 45, perimenopause should be diagnosed based on symptoms alone. Period. No hormone blood tests are required. And their guidelines specifically instruct doctors not to use blood tests to diagnose it.
I really want to make sure you are hearing this clearly because it is so empowering.
It really is.
If you are sitting in a doctor's office and you are over 45 and you are experiencing drenching night sweats or sudden irregular periods or that crushing, unexplainable anxiety.
You do not need a lab result to prove to your doctor that you are in perimenopause.
Yes, you do not need to prove you're suffering with a lab printout.
The guidelines exist precisely because chasing these fluctuating FSH and estrogen levels wastes precious time.
And money.
It drains your wallet, it causes massive health anxiety, and worst of all, it delays actual effective symptom relief.
Like HRT.
Exactly. Whether that is hormone replacement therapy or targeted lifestyle interventions, you treat the woman's symptoms, you do not treat her lab results.
Okay, but before we completely write off phlebotomists forever...
Let's not do that entirely.
Right, this raises an important caveat.
Yeah.
There are times when getting blood drawn during this phase of life is actually absolutely critical, right?
Yes, there are vital exceptions, mostly centered around age and overlapping health conditions.
Okay, let's go through.
The first is premature ovarian insufficiency, or POI. If a woman is under 40 or sometimes between 40 and 45, and her periods become highly erratic or stop altogether, FSH blood tests are strictly required.
Why is that different?
Entering menopause that early carries significant long-term risks for cardiovascular and bone health.
Oh, I see.
So an accurate, documented diagnosis is crucial for her long-term care.
But even in that scenario, they don't rely on just one snapshot test, do they?
No, they don't. The guidelines mandate 2 separate FSH tests taken at least 4 to 6 weeks apart.
Okay.
They have to confirm a sustained hormonal pattern, not just a temporary Tuesday morning spike.
Right, that makes total sense.
Yeah.
So what does this all mean for the rest of us? The second reason to get blood drawn brings up this brilliant concept of the perimenopause exclusion test.
Yes, the exclusion test.
Which sounds like a contradiction, honestly. We just spent the last 10 minutes saying you don't test to find perimenopause.
I know, it does sound counterintuitive at first. But the key word here is exclusion. We aren't drawing blood to prove you have perimenopause. We are testing to prove your symptoms aren't being caused by something else entirely.
We are actively hunting for the copycats.
Exactly.
So if you are advocating for yourself at your next physical, what should you be asking your doctor to test for?
You want them to check for the underlying conditions that perfectly mimic the perimenopausal transition.
Like what?
The 3 biggest culprits are thyroid dysfunction, severe iron deficiency, and low vitamin D.
Let's break those down. Why the thyroid?
Thyroid disease shares an astonishing amount of overlap with perimenopause.
Really? Like the same symptom?
Almost identical. Unexplained fatigue, sudden weight gain, thick brain fog, severe mood swings, and even heart palpitations.
Oh, wow.
Yeah. If your thyroid gland is underactive, you will feel exhausted, cold, and foggy.
And if it's overactive?
You might get hot flashes, anxiety, and a racing heart.
Well, that's just perimenopause in a nutshell.
Exactly. Measuring your TSH, thyroid stimulating hormone, is vital because if your thyroid is failing, no amount of estrogen HRT is going to fix your symptoms.
That makes total sense. You have to fix the actual root problem.
Right.
What about iron? A lot of people just associate iron deficiency with feeling like a little tired or winded.
It is much more profound than just feeling tired. And this ties directly back to what we discussed earlier. Remember the estrogen stacking?
The double doses causing incredibly heavy periods.
Right. Month after month of abnormally heavy menstrual bleeding completely strips the body of its iron stores.
Oh.
For this, we look at a marker called ferritin. Think of standard circulating iron like the cash in your wallet.
Okay.
But ferritin is the money in your deep savings account.
I love that.
When your savings account is drained from heavy bleeding, you experience crushing, bone-deep exhaustion, breathlessness, significant hair loss, and incredibly poor concentration.
And countless women are told their exhaustion and thinning hair is just part of getting older, right?
Oh, yeah.
Menopause.
All the time, when in reality, they are severely iron deficient.
Which means simply treating the iron deficiency could give them their energy back, even if their reproductive hormones are still on the roller coaster.
Absolutely.
Wow.
And the last major copycat is vitamin D.
Okay.
Chronically low vitamin D causes severe muscle aches, joint pain, fatigue, and persistent low mood.
Again, symptoms easily brushed off by a rush provider as just menopause.
Exactly.
So the real takeaway here is if your doctor orders a blood test, make sure they are checking your thyroid, your ferritin, and your vitamin D.
Yes.
Use the blood test to clear the path so you know for absolute certain that the symptoms you are left dealing with are actually stemming from the perimenopause transition.
Right. And not a highly treatable vitamin or mineral deficiency.
It's all about getting the full, comprehensive picture of your health, rather than chasing a single, chaotic reproductive hormone marker that changes by the hour.
Exactly. Treat the whole patient.
So let's bring this all together. Perimenopause is rarely a gentle, steady glide into our golden years.
Rarely ever.
It is a biological roller coaster of stacked estrogen spikes, plummeting, anxiety-inducing progesterone drops, and competing stress hormones, literally stealing your body's resources.
Beautifully summarized.
And if you take a single hormone blood test during this chaotic time, you are just getting a snapshot. It's a photograph that can easily miss the 100-foot drop, fooling both you and your doctor.
Which is exactly why global medical guidelines are urging the medical community to look at the patient, not the lab result.
Right.
If you are over 45, your lived experience is valid medical data.
Say it louder for the people in the back.
If you feel like you aren't yourself, if your sleep is broken, your mood is volatile, or your body feels completely alien to you, you shouldn't let a normal lab result on a piece of paper invalidate your reality.
You know your body better than anyone else. Don't let a snapshot tell you otherwise. But I want to leave you with a final thought to mull over.
Oh, okay.
We spent this entire time unpacking how a single blood test is just a photograph. But what if we could actually watch the movie? We are standing on the edge of an era where continuous, at-home, daily hormone tracking, like the data we explored today, might soon become the new standard of care.
It's entirely possible.
Imagine a world where, in just a few years, your doctor doesn't look at a single frame of your biology. Imagine if they could watch the entire roller coaster ride alongside you, see every spike and every drop in real time.
That would change everything.
How much faster could we find true relief if the medical field was finally watching the whole movie?